Our big focus this morning, the WHO's report, which says that between January 2020 and December 2021, there were 4.7 million excess COVID deaths in India, the maximum number, which is over 9 times official figures and almost a third of COVID deaths globally. That figure, according to the report, is 15 million. That's more than double the official number of 6 million global deaths. Well, India government's own data says that there were about 5.23 lakh deaths. And as we said, that WHO estimate about 9 times more than India's official figures.
That's right. And India has responded sharply to this report. India is hit out saying that WHO study lacks academic rigor. It says WHO hasn't addressed India's concerns and WHO's estimates are based on other estimates and the study disregards actual data.
We understand that this report has covered what they label as excess mortality in the years spanning COVID-19 pandemic. India has been clearly telling WHO with all humility and through diplomatic channels, with data, with rational reasoning, that we do not agree with the methodology that has been followed. We have a robust system of the CRS and we released that report yesterday, and as per law and the timeline, the 2021 numbers will also come up.
India has a very robust system of births and deaths registration which has been going on for decades. Well established system, we know that it works very well, and that data is available, and that is one data which should be used to really see what is the number of excess deaths that have happened during this time and what are the excess deaths which could be attributable to COVID. WHO has not used that data. The second important issue is that the data that WHO has used is more on hearsay evidence or what has been there in the media or from unconfirmed sources.
Meher joining us with the latest on that big story. Now, Meher, we've seen some very sharp reactions from the Indian government and indeed its sort of most reliable voices on the COVID pandemic. But when we look at the government's own death registration data, what do we see?
Yes, Ankita. So India has responded very strongly to this WHO report. You may remember that the New York Times had actually reported that this WHO estimation of figures was actually delayed because India wanted to change the way the numbers are calculated. There was a lot of dispute even before, but now the WHO has finally come out and said that India's estimated deaths of COVID are actually 9 times over the official death toll. So they've said there are 47 lakh excess deaths in India and the government record is only actually 5.23 lakh deaths. India has responded very strongly. As you said, they say that this lacks academic rigor, and they actually communicated with the WHO over 10 times, and each time they said our concerns weren't actually addressed. They said that the WHO is disregarding actual government data that has been calculated. As Dr. Guleria and Dr. Paul also said, there is a CRS registration system of deaths and births, and for 2020 the data has just come out. But if we look at that data also, there are over 3 lakh unexplained deaths even according to that. So if we look at that data, and there will be some graphic on that now, deaths registered in 2019, which is a non-pandemic year, was 76.41 lakh deaths. Deaths registered in 2020 were 81.16 lakh deaths, and excess deaths in 2020 were 4.75 lakh deaths. So COVID deaths recorded in 2020 were 1.49 lakh. So this makes unexplained deaths in 2020 3.26 lakh deaths. So this actually shows that according to government's own data, there is an unexplained number of deaths which were very likely COVID deaths that were not recorded, not counted by the government.
All right, Meher, thanks so much indeed for joining us with those details. Well, April 2021 was probably the cruelest year of the entire pandemic. The deadly second wave saw hospitals overflowing and health infrastructure in several states completely overwhelmed.
And now many families are observing the first death anniversary of their loved ones after 1 year. Here's a report.
"45-year-old Shaista Yasmeen, sister Sabiha and mother are yet to come to terms with the reality of losing their brother Sajid to COVID last year.
पिछली बार की जो हाहाकार थी वो कभी ना सोचा ना कभी देखा और ना होनी चाहिए। हमें तो पता ही नहीं चला। एक्चुअली 2-3 दिन उसकी थोड़ी तबीयत खराब रही। उसके बाद जब उसकी ब्रीदिंग तेज चलने लगी अचानक से, बातचीत कर रहा था ठीक था, तो हमें लगा कि शायद प्रॉब्लम है। तो हमने काफ़ी जगह एम्बुलेंस, हॉस्पिटल, पड़ोस में फ़ोन किया सबसे पहले तो कि प्लीज़ आ जाओ, कोई नहीं आया। रिश्तेदारों में फ़ोन किया, उन्होंने कहा इस वक्त नहीं आ सकते, बहुत बुरा हाल है।
35-year-old Sajid, who was differently abled following a spinal injury 15 years ago, died in an ambulance after not getting admission in several hospitals.
जगह जगह हॉस्पिटल ले गए, किसी ने नहीं लिया, कोई लेने को तैयार नहीं। आखिरकार वो उसकी डेथ उसी में हो गई, गाड़ी में ही। बस फिर हम घर ले आए। हमारे और 2 कजन्स के साथ प्रॉब्लम थी सेम, ये कोविड ही हुआ था, तो वो सब उधर लगे हुए थे, वो हॉस्पिटलाइज थे और तीसरे या चौथे दिन उनकी डेथ हो गई। बहुत बढ़िया इंसान, बहुत अच्छा लड़का, जिसके एक 7वीं क्लास में बच्चा, एक 10वीं क्लास में। इधर तो बहुत ही छोटे बच्चे थे जो मेरे कज़न हैं यहाँ पे, उसका भी एक बच्चा, तो उसे तो ये भी नहीं पता फादर मेरे नहीं रहे। लड़की थोड़ी सी बड़ी है, तो बहुत बुरा टाइम था, नहीं बर्दाश्त होता याद करके।
Sajid's mother Raisa Khatun believes her son would have survived had he received adequate medical care. The family, which owns a small boutique in northwest Delhi, has got no compensation from the Delhi government.
इस बच्ची में बहुत हिम्मत है मेरी, ये सब कुछ कर रही थी जब से। बाकी तो भैया बच्चा ये रही, जो भी था मुझे तो कुछ समझ में आ ही नहीं रहा था। उसकी तबीयत खराब थी, उस वक्त ही मैं कुछ नहीं समझ पाई कि ऐसा कुछ हो जाएगा। इसको मैं तो
ठीक था, ऐसे थोड़ा सा खांसी नजला हल्का सा लग रहा, ये रोने लगी तो कहने लगा मैं तो आ जाऊंगा, अभी थोड़ा सांस लेने में प्रॉब्लम हो रही है, बस कोई मुझे ऑक्सीजन दे देगा। अब ऑक्सीजन तक पहुंच ही नहीं पाया, शायद ठीक हो जाता उस वक्त। यानी अगर स्टीमर था ना, उसके भी चौगने रेट लगा देते, जो 100 रुपए की चीज है उसके भी इतने रेट लगा दे और गायब भी कर दी मार्केट से। अब पेशेंट को देखो या पागलों की तरह से केमिस्ट ढूंढो, हाथ पैर जोड़ लिए केमिस्ट्रियों के भी, वो जो हर वक्त दवाइयाँ हमारे लाते हैं वो भी तैयार, वो कह रहे है ही नहीं, हम क्या करें, है ही नहीं, पीछे से ही सारा माल रोक लिया गया है। ऐसे में बजाय हेल्प करने के, इतना बुरा टाइम था, सारे बच्चों को मार दिया।
क्या सरकार ने अपने वादे पूरे किए, जो कहा था मदद करेंगे, लोगों तक पहुंचेंगे?
कुछ नहीं किया। अगर जो वादे किए उसको 20% लोगों को भी शायद फायदा ना हुआ हो।
According to government data, over 26,000 people died of COVID in Delhi alone. But there were many who were never included in the government's data. Sajid is one of them. 63-year-old Ashok Kumar and his 56-year-old wife Meenakshi Kumar got their daughter married just 2 months before the second wave of COVID-19. But their happiness was short-lived.
हॉस्पिटल वालों ने बिल्कुल भी केयर नहीं की।
मेरे को इतना पता है वो बच सकते थे अगर हॉस्पिटल वाले केयर करते। उसके बाद कभी कोई बीमारी उनको पहले रही
कभी नहीं, नथिंग, बिल्कुल। बल्कि मैं बीमार रहती हूँ, आए दिन मुझे डॉक्टर के पास ले जाते थे, लेकिन इनको कभी कुछ भी नहीं था। मतलब हमने सोचा भी नहीं था कि ये 22 तारीख को जा रहे हैं और 4 दिन में ही 2 महीने पहले बेटी की इन्होंने इतनी खुशी खुशी शादी की। उसके बाद इतना खुश थे कि चलो अब बच्चों की 2 बेटियों की शादी कर दी, अब हम फ्री हो गए, अब हम आराम से वो करेंगे। लेकिन ये वैक्सीन लगाई इन्हें, उसके बाद ही हम दोनों पॉजिटिव। हालांकि कोयल वालों को बच्चों ने मेरी सीटी स्कैन की रिपोर्ट दिखाई तो कहते हैं इन्हें भी एडमिट कर दो।
A year later, the trauma is still fresh.
तो लगता नहीं है कि अभी मतलब लगता है आ जाएंगे। मैं दुकान में बैठा तो अभी लगता है गेट खोलेंगे आ जाएंगे। सपने में रोज आते हैं कि साथ हैं मेरे बस।
Jitendra Singh Shanti, who runs an NGO that provides ambulance services, cremated over 4,000 bodies of COVID patients.
शहीद भगत सिंह सेवा दल ने लगभग 4200 डेड बॉडी का क्रिमेशन कराया है, लेकिन मैं वो मंजर भूलता नहीं हूँ। ईश्वर ना करे ऐसा मंजर कभी आए कि 250 तक डेड बॉडी हमने एक दिन में क्रिमेट कराई है। कई जगह तो स्ट्रेचर नहीं थे। ऑक्सीजन तो बहुत बड़ी बात है, वेंटिलेटर तो बहुत बड़ी बात है, स्ट्रेचर तक नहीं थे, कई गवर्नमेंट हॉस्पिटल में भी नहीं थे।
Jitendra Shanti and his son, Dr. Jojit Singh, work relentlessly even at a personal cost.
So looking at those scenes and then cremating like 100 and 150 dead bodies every day, that thing literally made me slip into depression. And I've been taking medication for that for about 2 years now. I'm still on my depression pills. And that massacre that happened in Delhi, I don't call it a disaster. Disaster is something that goes out of your hands. It was a planned massacre. The government could have saved those lives.
Exactly a year back, where I'm sitting, bodies of those who lost their lives due to COVID-19 were being kept as there was no place inside the crematoriums or at the morgues of hospitals. The second wave of COVID-19 devastated millions of families, and while many died because of the disease, many also died because of the underprepared healthcare infrastructure. And while the vacuum that is in our lives because of those who have left us because of COVID-19 can never be fulfilled, the question that still remains is that are we better prepared exactly a year after the second wave of COVID devastation? With camera person Mohammad Mursaleen and Ashok Mahale, I'm Akshay Dongre for NDTV.
Joining us now, Dr. N.K. Arora, Chief of India's COVID Working Group. Thank you very much indeed for speaking with NDTV. Dr. Arora, let me begin by asking you, this WHO report, it's come up with a staggering number, 9 times India's official estimates. India, of course, disagreeing with the methodology. Can you explain to us why India is uncomfortable with these numbers?
India is just not uncomfortable because these are untenable figures. In fact, in your report, you have shown that in 2020, 81 lakh deaths were reported overall in the country as far as CRS is concerned. And these 81, and if we go by WHO estimates, that gives us that almost 25% of deaths in India in that year were because of COVID. That's what it shows. It's about 20 lakhs. That's what it is showing, that 47 lakhs in 2 years. So about 20 lakhs in the 2020.
But Dr. Arora, even those CRS figures that you refer to are talking about, over 3 lakh unexplained deaths.
I'm coming to that, and I hope you will allow me to give you some figures. In 2018, 5 lakh extra deaths were reported by CRS over 2017. In 2019, 7 lakh deaths were excess over 2018. In 2020, 5 lakhs, 4.6 lakhs, as you said. I'm putting in rounded figures. 5 lakhs deaths, excess over 2019. Now, what does that mean? Over the years, gradually, CRS coverage of deaths is improving. And now we are over 98, 99% of all the expected deaths are covered by CRS. CRS is a decades-old system. It's a very robust system. And over the years, it has improved. It is not a system which has been put up in last 1 decade or so. It is for several decades it is there. And during last 7-8 years, gradually the number of deaths are increasing, although the population is increasing. So there may be some excess deaths because of the increasing population. But we also know that there is improved average age of Indians is increasing. Third dimension is that along with increasing age, increasing health system, the most important thing which is happening is that CRS performance is improving. They were able to, in 2018, it was around 85-88% deaths were covered. And by 2020, it is now 98-99% deaths covered. So every year there is increase, because between 2018 and 19, 7 lakh additional deaths. Do we say that they are all COVID? Because COVID was
so Dr. Arora, if I may,
just a minute,
respectfully.
So what I'm saying is that in 2020, we don't have 21 data, and very soon it will come. That will also be public domain. But out of the excess of about 4.6 lakh, 1.45 was the reported deaths. So those 3 lakh deaths, there are other deaths are also, and our death comparison is also. Let us say all 4 lakh were extra. Even then, it does not fit into the WHO estimates. It was preposterous. So what I am trying to say is, there may be missing of some deaths. 5, 10, 15% deaths are obviously not everything is recorded. But the way WHO has put us in tier 2 countries where no data is available, where modeling and estimates are done, whereas we as India has very robust CRS system.
Right. So you're objecting to the classification in tier 2 also, Dr. Arora, and we take that as a valid point. But what do you say to those critics who are saying that, COVID deaths have been underestimated? We're not going by how many deaths it's been underestimated by, but because of sort of compensation reasons, that states perhaps are not reporting to the center accurately either. Would you say that there could be some lag there?
So there was lag, and after Supreme Court ruling, and there has been kind of last 6 to 8 months, every state has been putting up these extra death numbers, which were missed out in the previous ones, and now they are all part of the current system. So many times, even in states like Kerala and the other very well-performing states, additional deaths have been added up into the recent numbers. So it's a huge country. So there would be some missing, but it is not that we are talking about 10 times higher, which the other thing is, if it was so much, then people should have swam after WHO, because the Indian definition of COVID death is any death occurring within 1 month of being diagnosed as COVID. Nothing much has happened. People have been coming and compensation is being paid out, but there is nothing like 40 lakh people have not come in. Otherwise, they should have come in if they were all dying because of the COVID. So there are several inconsistencies, and I will also put one other important point. See, India has managed with COVID, which is 1.9 billion doses distributed vaccines and a very good management. For everybody has to accept this is one of the finest IT platform. We can manage that. We have a great platform for managing RT-PCR and RAT tests across the country. Then our own death data to say that it is not reliable and putting us in tier 2, I think one has to see that this is not correct. This is very unfortunate that WHO has done something of that kind. And I think a time has come that we say this is what is the truth.
Okay,
and
fair enough. Dr. Arora, let me put it to you in this way, that, we saw hospitals being overwhelmed. We saw many people not being able to take COVID tests at the time. And so therefore, there were some deaths that were registered as not COVID deaths. So that might in fact account for some of the discrepancies. But also apart from that, just given the overwhelming number of deaths, perhaps, is it fair to suggest that the registration systems also couldn't keep up in the same way that labs couldn't keep up and hospitals couldn't keep up?
See, Ankita, as I said, we have death registration is a very robust system. I think to start doubting, then everything, given
the circumstances, Dr. Arora, I absolutely take your point about the death registration system being completely robust in normal times. But these were not normal times.
Even in this time, when we are saying that from year to year, there has been increase in the registration of deaths. That means system is improving. We will say, okay, the system is not improving. Even then, I am saying that the excess deaths were 4.6, out of which 1.45 has been said. And I think there is no harm in saying that 10 to 15% deaths or up to 20% deaths may have been missed, but nothing like what WHO is saying. That does not fit into any kind of and in fact, if we look at the deaths per million, India is one of the lowest. You talk to any corporate hospital, you talk to any government hospital, we have around 372 deaths per million as compared to 3,000 or 2,000 plus deaths per million in most of the high income countries. Our doctors have managed the way overall there are other reasons also why the pandemic is likely to have less impact on us. We also know many very celebrated journals across in 2020 they predicted a doom for us. In 21 they said we will take 5 years to 25 years to immunize our 1 billion population. I think they have all been proven wrong. And even this, I would say, that we should really be worried that why such a kind of a statement has been made, which doesn't stand on any kind of logic or fact.
Dr. Arora, thank you so much for joining us on the show and talking to us about the WHO report and India's very strong stand against it.
Welcome back. Congress leader Rahul Gandhi will be in Telangana today to address a meeting in Warangal this evening. Yesterday, BJP President JP Nadda held a public meeting in Mehboob-Nagar.
And there he said the people of Telangana are waiting for a change and would choose the BJP.
कि दुबाका में धमाका क्या हुआ और हुजूराबाद में हुजूर गिर गए कि ये सारी घटना ने केसीआर साहब को विचलित कर दिया. He has gone disturbed. उनको बहुत तकलीफ हो गई है. लेकिन मैं कहना चाहता हूं कि हुजूराबाद में हुजूर का नीचे गिरना और दुबाका में धमाका होना ये अगले धमाके की निशानी है. इसको भी हमको याद रखना चाहिए. मित्रों, जनता अब चल पड़ी है आपके साथ. जनता ने तय कर लिया है कि वह यहां परिवर्तन चाहती है. वो यहां पर भारतीय जनता पार्टी के नेतृत्व में सरकार देखना चाहती है और वो मोदी जी का आशीर्वाद और नीचे भारतीय जनता पार्टी की सरकार, डबल इंजन की सरकार तेलंगाना को आगे ले जाने वाली है.
Well, it's day 72 of Russia's invasion of Ukraine, and the Interior Ministry of the separatist region, the Donetsk People's Republic, has released video footage of the Avostal steel plant in Mariupol.
The video, which was released on Wednesday, features military vehicles in the plant and a series of explosions hitting industrial buildings. There was no information provided, though, as to when the video was shot.
A cleanup operation took place in the center of Mariupol on Thursday as Ukrainian fighters held out against Russian troops in the city's pulverized steel plant. The rest of the city is now under Russian control.
Municipal workers as well as volunteers were seen clearing debris near charred buildings, including the drama theatre where hundreds of people died when the Russian military bombed it in March.
Russia responded to a report by the UN Secretary General by doubling down on its contention that Ukraine is responsible for the Russian war.
Russian ambassador accused the West of using the conflict as an excuse to punish Russia, saying they have long dreamed of transforming Ukraine into a bridgehead for a battle against Russia.
Вот уже 2 месяца мы обсуждаем события на Украине, и 2 месяца, помимо потока враждебности, лжи, фейков, ненависти и оскорблений, мы слышим один и тот же вопрос. Как могла Россия неспровоцированно, как они говорят, напасть на суверенную, демократическую, неагрессивную, независимую, мирную Украину? Ведь она не представляла никакой угрозы для самой России. Среди тех, кто это говорит или кто так думает, допускаю, есть люди искренние, не понимавшие, что на самом деле происходило все эти годы. А есть люди и страны лукавые, давно мечтавшие превратить Украину в плацдарм для битвы с Россией. И они делали все для этого с момента обретения Украины независимости 30 лет назад. Политически, идеологически, а сегодня продолжают делать это, накачивая Украину вооружением.
Let's move on for the moment. The controversial citizenship law appears to be back on the centre's agenda. Union Home Minister Amit Shah has said the Citizenship Amendment Act is a reality and will be implemented as soon as the pandemic is over. He was speaking in Bengal. Chief Minister Mamta Banerjee hit back, calling it rubbish.
मित्रों, आज मैं उत्तर बंगाल में आया हूं। मैं आपको स्पष्टता कर जाता हूं। तृणमूल कांग्रेस सीएए के बारे में अफवाहें फैला रही है कि सीएए जमीन पर लागू नहीं होगा। मैं आज कहकर जाता हूं, कोरोना की लहर समाप्त होते ही सीएए को हम जमीन पर उतारेंगे और हमारे भाइयों को नागरिकता देंगे। ममता दीदी, आप तो यही चाहती हो कि घुसपैठ चलती रहे, मगर कान खोलकर तृणमूल वाले सुन ले, सीए वास्तविकता था, वास्तविकता है और वास्तविकता रहने वाला है। इसलिए आप कुछ नहीं बदल सकते हो।
This is their plan. They have not amended defending of sin. Why they have not bringing this bill to this parliament? We don't want any citizen's right to come. We want all, we have to stay together. Unity is our strength and divide is fall. It is Swami Vivekananda that said. Now after 1 year he came, he should have been hide his face. What his behavior we have seen at the time of election. हर साल आते हैं, गंदा बात करते हैं.
Alok Pandey joining us with the latest on that story. Alok, Mamta Banerjee, of course, never minces her words. This time, really dismissing what the Home Minister said as rubbish.
Well, I guess so. Let me start by saying that it's quite a joy to report from your city, Ankita. But there's certainly no love lost between Mamta Banerjee and Amit Shah, it seems. The contentious issue yesterday, of course, was CAA. And that is something that the BJP would look to, especially in the run-up to the 2024 Lok Sabha elections. Amit Shah's visit is very crucial, and the way he said what he said on CAA is also very crucial. Because this was perhaps the first public endorsement that the BJP was still looking at to push ahead with the CAA, and the fact that he said it in Bengal, where the party has suffered reverses of late. Remember that in the 2021 assembly elections, there were many who put the BJP ahead of Mamta Banerjee and said that they were on the way to forming the government. As we know, that did not happen, and Mamta Banerjee won a very comfortable victory here in West Bengal. And since then, the BJP has lost in assembly by-elections, in Lok Sabha by-elections. They lost the Kolkata municipal election. There have been defections. Amit Shah, for instance, yesterday spoke about how and thanked the people of West Bengal for getting the BJP from 2 or 3 MLAs to about 77. But the fact is that the party doesn't really technically have 77. Some of them have deserted the party and gone to the Trinamool Congress. So those are the challenges in front of the BJP as it looks to rev up its campaign for the 2024 assembly elections. And Amit Shah is a crucial election strategist. He's going to be in Calcutta today. And he's going Kolkata, and he's going to hold a host of meetings. So he'll come in by 12:30ish, and then he will be holding meetings with the BJP leadership here for close to 2-3 hours, and then again in the night. So really what he says to the BJP and how the BJP pushes ahead in a state where the Trinamool Congress is dominant is what will be interesting to watch in the next some time.
Alok, thanks so much. And of course, we'll come back to you for more as Amit Shah tries to revive the BJP's fortunes in Bengal. Time for a quick break. Coming up next, Congress leader Rahul Gandhi is going to be in Telangana today to address meetings. This a day after the BJP president was in Mehboob. We'll have more in a moment. Congress leader Rahul Gandhi is going to be in Telangana today to address a meeting in Warangal this evening. Yesterday, BJP President JP Nadda held a public meeting in Mehboob Nagar where he said the people of Telangana were waiting for change and would choose the BJP.
कि दुबाका में धमाका क्या हुआ और हुजूराबाद में हुजूर गिर गए कि ये सारी घटना ने केसीआर साहब को विचलित कर दिया. He has gone disturbed. उनको बहुत तकलीफ हो गई है. लेकिन मैं कहना चाहता हूं कि हुजूराबाद में हुजूर का नीचे गिरना और दुबाका में धमाका होना ये अगले धमाके की निशानी है. इसको भी हमको याद रखना चाहिए. मित्रों, जनता अब चल पड़ी है आपके साथ. जनता ने तय कर लिया है कि वह यहां परिवर्तन चाहती है. वो यहां पर भारतीय जनता पार्टी के नेतृत्व में सरकार देखना चाहती है और वो मोदी जी का आशीर्वाद और नीचे भारतीय जनता पार्टी की सरकार, डबल इंजन की सरकार तेलंगाना को आगे ले जाने वाली है.
Uma Sudhir joining us with the latest on that political story. Uma, ahead of assembly elections next year, has the battle for Telangana well and truly begun now?
Elections in Telangana are at least 1.5 years away, and yet battle for Telangana seems to have already begun. It will almost seem like it is election season now with the BJP president here. Of course, yesterday he was at Mehboob Nagar for the Praja Sangrama Yatra of the state BJP president Bandi Sanjay, the second leg of his yatra that he is covering some of the districts despite the very, very hot summer month that we are talking about. And yes, JP Nadda, interestingly, is in fact targeting the TRS on exactly those things that they are claiming credit for. All the flagship programs of the TRS government here, whether it is Kaleshwaram, Mission Kakatiya, Mission Bhagiratha, all those Mr. Nadda alleges that the TRS has made money, and in fact he called Kaleshwaram as an ATM and a milch cow for the Chief Minister KCR. The other side, he is also in fact saying that many of those schemes he claims, Ayushman Bharat and other schemes of the Prime Minister, he claimed that KCR is not allowing the benefits to reach the people, and he also claimed that those schemes are being copied by the state, the schemes that have been started by the central government. That may not be very true, in fact, because the state governments, the governments here have had the insurance schemes and these Ayushman Bharat versions here, larger version in fact here in many of the southern states, including Telangana. Rahul Gandhi, of course, arriving later this afternoon here in Telangana, and he'll be going straight to Warangal, where he's expected to be addressing what is being called as the Raitu Sangharshana Sabha. Meaning it's going to focus on the farmers, and we are expecting that the Congress will put forth what is going to be called, they say, the Warangal Declaration, where they'll put forth their agricultural policy. Once again, interesting, because the TRS government has been claiming big success with farmers, both in irrigation projects as well as in the productivity going up, and they in fact want the paddy that's being grown here to be bought by the centre, saying that we have increased productivity so much that we have become the rice bowl of the country itself. And yet Rahul Gandhi is going to focus on farmer suicides and farmer distress, and saying that they are going to put forth something new for the people. Politically, Telangana certainly holds a lot of potential. That's what at least the BJP and the Congress see, because for the TRS government, this is going to be a third time running that they are looking to form the government next year. And what that would mean is that they have 2 terms of incumbency to fight, and that's something that they want to capitalize. And in the last election also, they had won over 88 assembly seats out of the 117, and post the elections with the crossing over from Congress, etc., they had more than 100. That's the number that they hit. And now, because it is one-sided, many people feel that there is a vacuum in the opposition space, which of course the Congress wants to recapture and the BJP wants to capture anew. And that's why Mr. Nadda is quoting Dubak and Huzurabad, where in by-elections the BJP had in fact had victories, and they're hoping to capitalize on that and build on that. And that's why they're targeting specific districts that they believe could help them win more number of seats here. Back to you.